Hello there, my name's Meredith. Today we're going to be performing your cranial nerve examination. So what I'm going to do first is I'll just let you know a little bit about it. So you're not going to be having a full examination from head to toe. Looking at your notes here, it doesn't really look like you need one. If there's anything that I might see that you would need to have a full one, then I'll let you know. But as far as I'm concerned, at the moment, we'll just stick with the shoulder to head part, if that's okay with you. Okay, great. Now, just to let you know as well that I will be touching you in different areas of your face and also your shoulders, and I'll check your arms as well if you like. So if you do feel uncomfortable at any time, it's really important to let me know so that I can stop for you. Okay? Okay, good. So what we're going to do first is, the first part is just going to be answering just a couple of wee questions, okay? And they're just simple ones, so sort of gives us a look to make sure that you're in the right time at the moment, okay? So what I'm going to do is I'm going to be ticking things off, I'm going to be typing throughout this, okay? So just relax and it will be over and done with as soon as possible, okay? Okay. No, there won't be any needles in this today. No, you don't have to worry about that. Oh, well, you'll be quite surprised. I'm actually terrified of needles. I don't like them at all. I never have, and I probably never will. So there's a few doctors out there, that specialise in this type of thing. Don't like visiting the doctor either, or getting the needles, or annual checkups. Can be a little bit nerve-wracking, to be honest. Okay, so would you please be able to answer the following questions for me? What is your full name? So I want your first name, your last name, and your middle name if you have one. Thank you very much. And what day is it today? Good. And which month is it? Very good, thank you. And could you please tell me your date of birth? Great. And which year is it today? Thank you. It's nice to see that you're here with us in the right time. And just one last question here for me, thank you. Could you please tell me the name that I introduced you to just before? So my name. Thank you, very good. Yes, you did very well for that part. Okay, so for the next part today, I'm going to be touching around your face, if that's okay, that's okay? Okay, so I'll just wash my hands first, better do that. Okay. Just pop in my gloves. They are latex free. Okay, so as I'm just putting them on, I'm just going to be, just look at me straight for me if you would, thank you. And I'm just going to be looking at your face, making sure that things look symmetrical. Well, they do look symmetrical, so that's good. You also have a clear disposition, you don't look dirty, and I don't see any cuts or lesions that I can see at the moment. So what I'm going to do now is I'm going to come a little bit closer, if that's okay, and what I'm going to do is I'm going to just feel around your jaw and also around your head as well, if that's okay. That's fine, okay? Remember, just let me know if it does feel uncomfortable. Okay. Well, I don't see anything so far, so that's a good sign. No, it doesn't hurt around here at all, does it? Okay, good. Okay. So I'm just going to check your head now. And there's no weird bumps or anything, and nothing looks strange. It's a tiny wee bit oily. Okay. Okay. So, it does look a little bit oily. I don't see anything concerning or anything. I can see a little bit of dandruff as well. So do you wash your hair frequently, like every day, or twice a day even? No, it's not a problem. Look, so it's not enough to send you to a dermatologist. Really, you should really just don't really wash your hair every single day, because it makes your hair very dry as well. I know it can't be helped sometimes, especially if you have oily hair, but you know, it's strange because you have oily hair but you also have a little bit of dandruff as well, so that's sort of strange, and it sort of doesn't really combine at all. But saying that, if you are going to wash your hair every single day, you're better using something that's very natural, and you know, it hasn't got all the chemicals in, because all the harsh chemicals getting on your skin isn't really good and healthy for you. So if you like, at the end of this examination, I can write a couple of products down for you and you can give them a go if you like. But as I said, it's nothing serious, so if you want to carry on using the shampoo that you use now, that's perfectly fine. Okay, so I didn't see anything underlying there or anything strange. Okay, let's quickly pop the notes down here. Now, the next bit, you're going to be pulling a couple of faces, okay? Now don't feel alarmed by it. We'll have to do this sometime in our life. So I'm going to get really up close to you again, okay? So I'm going to be feeling a lot of things. What I want you to do first is I want you to just give me a nice big smile for me, show me all your teeth. Good. Now I'm going to be touching your jaw now, okay? Okay. Does that feel strange at all, or? No. Okay. Okay, and just smile without showing your teeth. Very good. Okay, now what I want you to do is I want you to frown for me, so something that's made you really, really angry, or something that you don't like. Good, thank you. Now raise your eyebrows for me as far as you can so you look very surprised. Great, thank you very much. Okay, now I want you to close your eyes for me. Okay, good. So keep them closed and I'm just going to press against them. Okay, good. Keep them closed. Okay, and I'm just feeling around your sinuses now, okay? Okay, good. You can open your eyes now. And I'm going to touch your nose. Anything feel sort of pressured around there? Nope. Okay, good. Now what you want you to do is I want you to stick out your tongue for me. Yep, very wide. And I'm just going to get a really good look in there. And put your tongue up for me. Okay, I'm just going to get a really good look at those veins, making sure that they're a nice colour. Nothing's pulsing out. Looks very good. Now just with your tongue, I want you to put it to the side like this. Okay, good. And I'm going to press just against it, okay? So don't let me push it back. Okay, and just on the other side, thank you. Okay, good. That looks very good to me so far. Okay, so I think we're done with that for now. We'll start with your eyes and then we'll look at your ears after, okay? Okay, so with your eyes, I'm just going to be looking at them, making sure that the iris and everything looks in good colour and your pupil dilation as well. So I'll get you to do first is I'm going to take this wee sheet out for me. What I want you to do is I want you to go from the top all the way to the bottom if you can, okay? And I'm going to come it a little bit close, so first of actually, if you could go from here, then all the way to here, okay? And then we'll go back a little bit more and you can read these ones. Okay, so ready when you are? Very good. And just a wee bit back. Start on this. Very good. Thank you. Very good. That was very good. Thank you very much. Okay, so that was very good vision right there. Okay, so now that we've done that now, we're going to sort of introduce the light now, okay? So if it gets too bright, let me know, okay? So we'll do it just a wee bit far and then I'll go inside and we can do all that sort of business, okay? Okay, so what I want you to do first is I want you just to get used to the light, okay? So I'm going to direct it right in front, okay? Get used to it, just get used to the brightness because it is a wee bit bright. Okay, so now that's right. What I want you to do is I want you to keep your head very still and I want you to follow it in the direction, okay, just with your eyes. If you find it difficult to do, let me know. Okay, so here we go. Just a little bit faster. Okay, good. Now what I want you to do is I want you just to close one eye for me, so just put your palm in there, come a little bit closer, make sure that your pupil is dilating properly. Okay, that's good. Try it again. Good. Now just swap with the other eye for me. Thank you. Good. Very good. That looks very good. Thank you. Okay, so I'm going to come a wee bit closer now, if you don't mind, and I'm going to look in both eyes now for a direct and consensual. Okay. So. You're doing very good so far. It's not too bright for you. Good. So direct. And then consensual. So direct. And consensual. Okay, now I'm just going to have a really good look at your eyes now, okay? So, sure this light's working. It is, okay. That looks really good. Okay, thank you very much. That looks very good. Thank you. Okay. So what we'll do next is I have another light switch here, but it doesn't actually work. So what I want you to do is, first of all, I want you to actually tell me what colour it is first. Very good. And what I want you to do, we're going to do more or less exactly the same thing where we're just following, okay? And I want you to close one eye and follow it, okay? Okay. Okay, and just swap the eye. Very good. Thank you very much. Thank you. Okay, now one last thing with your eye. I have a pack of trusty cards here. And I want you to tell me what one's which from a distance. Okay. So, I'll go with this one first. Correct? Good. Good. Great. 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 Lovely. And one more. Thank you very much. That's very good. Well, your eyesight seems to be in tip-top shape here. Okay, now we only have a couple more things to do, so get your senses going. We're going to be smelling some stuff now, and you're going to close your eyes for me. Thank you. And we're going to be recognising each smell. So we will start first, so close your eyes, thank you. Thank you very much. Okay. Could you please tell me what that is? Great, thank you very much. Yes, it was rose. Keep them closed. And this one. Very good. And trusty peppermint. And one last thing. Smell that one for me. Yes, very good. That's almond. Okay. Okay, that's very good. Thank you very much for that. So what I'm going to do now is we've only got a couple more things to do now. I'm going to be checking your ears, okay? Okay, so if you could just move your ear to the side for me and we'll check its temperature. Good. And just on the other side here. Thank you very much. Now what I'll do now is I'll just have a look inside your ear. And each one. So on this one here. Nothing hurts, and again no cuts or lesions anywhere. Okay. Okay. What side is that on? Good. And this side too. Very good. Now tell me when the noise goes away, okay? Good. Very good. Thank you very much. And could you please tell me which words I say into your ear? Bilbo Baggins. Great. Aragorn. Good. Frodo. Good. Merry and Pippin. And once more, the ring. Very good. Thank you so much for that. You did a really good job. Okay. So, we're not going to be doing your arms today because I actually don't think that you need to have that done. But of course, you're more than welcome to make another appointment if that's what you wish to do. But as far as I'm concerned, everything looked absolutely perfect. You absolutely aced it basically. So what I'm going to do is I'm going to fax everything off to your normal doctor, and they'll go from there whether or not they want to do another time where they can do an absolute full examination, and we can book that in for you, and you're more than welcome to come back to me if you like, okay? And we can get that done, okay? Okay, thank you very much. Well, thank you for coming in. It's been a real pleasure. You've been my favourite patient so far anyway, so... Oh, thank you. That's very nice. Okay, well, it was lovely to meet you. Okay, I'll just... Oh, thank you very much. Okay then. Okay, I'll see you later. Thank you. Bye.